morning, good afternoon, and good evening from where you're watching. My name is Nwagaba Nicholas, and I work with Triggerize as the program lead for Uganda. You're most welcome to our ecosystem. As you see in the background, this is called Bwaise, one of the suburbs of Kampala City. And we are very excited to bring you our ecosystem, to bring you live from your laptops, from the comfort of your home, from the comfort of your office. So you're most welcome. So today we'll be taking you around the community and we'll be showing you and we'll tell you about our ITH program in Uganda. As before, I would like to introduce Triggerize. Triggerize is a Dutch non-profit that uses our tech-enabled platform to connect girls to quality assured services. So our role as Triggerize through our Tiko system, as you'll be hearing from all the speakers coming up, is to connect girls to quality assured service providers where they can easily access services that are important for their health. So briefly to tell you about ITH Uganda, we launched this pilot program in Uganda in March 2021 last year, and our program was aimed at reducing teenage pregnancies in Kampala and in Arua through increasing access to sexual reproductive health products. And we were able to, achieve all the things that we were able to achieve because we worked with partners. We worked with the Aga Khan Foundation in Uganda, who was our lead implementing partners, and we worked with demand generation partners, who are CBOs that you'll be hearing today, who was helping us to identify mobilizers in our community that were helping to create demand and connect us to the adolescent girls most vulnerable that come from this community that needed those services. But then we also work with quality assured service providers. So we did work with clinics from Reproductive Health Uganda, we worked with clinics from Maristops, also worked with clinics from PSI. And all these clinics and all these demand generation partners and retailers, as we'll be saying, helped us to create this ecosystem that we'll be telling you about. And through that, we've been able to increase access to adolescents in our community. Over 35,000 girls have been able to access SRH products, both HIV and family planning services through our platform. And we're very excited to be telling you more about how this was done and the partners that enabled us to be able to reach this. But before I go, I'd also love to remind you that we are coming to 1st December, which is the International World AIDS Day, a day that reminds us of the people that we've lost in the fight against HIV. And us as Triggerize, we're very excited about this opportunity because as we scale up the ITH project, we are thinking about adding new offers to our platform. So adding HIV prevention services, adding HIV treatment services, and we know that in Uganda is one of the countries where HIV pandemic or epidemic is still high. Over 43% of new infections are happening among this young age group of 15 to 24. And we know the reasons why this is happening. And we know that again in that same community, over 37% of these are adolescent girls. And that tells us that actually new HIV infections are becoming very high amongst this age group. And that calls for such innovations like the Tiko program and our Tiko approaches to use those behavior nudges actually to promote. We know that some of the challenges we face in our community to getting to ending HIV is HIV stigma. We know how that is working a number in terms of limiting people from accessing HIV services, but especially internal stigma that really creates that fear for most of our young people to be able to walk to the clinics, test for HIV, but also adhere to treatment. But we also know that our risk perception amongst the young girls and boys within our country is still low. So issues around using of a condom, issues around when you enroll in treatment, sustained use for treatment is also very low. And we hope that through our Tiko program we'll be able to change that behavior for good. We'll be able to encourage girls to enroll in treatment and continue their treatment journey. But then even for HIV prevention, we'll be able to enroll people in PrEP and help them access this service and continuously use that services. So you're most welcome to our ecosystem. You'll be hearing from a number of our speakers who will be telling you about how our program has been impactful in changing their life, but also taking you around the community to understand how we're able to do this. And I would like to introduce our next speaker, who is coming from a CBO within the Wempe division, Bwaise, that has been helping us to generate demand in this community and linking us to the girls within this community. As you know, our mission as Triggerize is really to serve the underserved girls in the community. Communities like this, as you see in our background, where girls are hard to reach, where girls are unable actually to have the ability to pay, and in all our services on our platform are free. to ensure that we connect them to private clinics like we're going to see, which provide them that needed service that they need, but also give them that opportunity to rate our service. So making sure that we are providing accountability and we are providing a service that is unique and respond to their unique needs. So allow me to welcome our next speaker from our CBO, Somero Uganda, to come and tell us their experiences as well. Thank you.
Good afternoon. My name is Tim Grace. I am the Finance and Admin Officer, Somero Uganda. Somero Uganda is a grassroots organization that is based in Kawempe Division. Somero Uganda was founded by a group of young people living in the slums of Kawempe Division, and we run a number of programs in Somero Uganda. We do the HIV program. We also do the child labor program. We also skill students. We do life skill trainings in our organization. We do hairdressing. We do secretarial. We also do photo and videography skills for our students. We learned about the Tiko program through Aga Khan Foundation and Sugarlize, and we support the foundation by bringing in young village champions and on board. So we normally train these young girls, and we train them to become super peers in the community. So they are as well going to the community and train other people who are brought into this program. So how Somero has supported this program, we have basically taken these girls through a number of health programs through using mobile phones, providing services, I would say, providing health services through using a mobile phone. So on Women's Day, we also supported the program through running a campaign. It's called a Kwepping Up campaign, which in turn attracted a number of 200 and plus girls into this program. We have also trained and we have trained mobilizers in this program, and we normally work in 3 divisions: the Kampala division, the Kawempe division, and Nakawa division. So these mobilizers normally go out into the divisions and train these peers of players. So I would like to introduce one of our mobilizers to take us through the program.
Okay, my name is naturally Rashida, Tiko mobilizer, and I mobilize in the community where I live. I live in Bwaise, but basically Tiko is our platform where we engage our adolescent girls, my fellow adolescent girls, when they access HRH services for healthy, okay, like this program had helped us a lot in the community where I live with my fellow girls. It helps us to access healthy services within the healthy centers which are nearby, and also this program has brought a lot to us in our lives, whereby a lot of girls have benefited in this. And I hope and I'm pretty sure that there is a big change in adolescents within the slums areas. For example, in the community where I live, where I work as a mobilizer, a lot of girls have received services via Tiko platform, and these girls, to get these services, they always be enrolled to this platform through phones and cards, and we want to make it to be like ongoing, such that also the other girls be like getting the services, and or like there is a lot of adolescents whereby they have been benefited through this program, and some of them, they are around, they can also give a testimony about this and a platform where they have used to get the service.
Okay, maybe just a question. What kind of activities do you have in the community that maybe bring together these young girls?
Okay, activities always we do a lot, and here basically we do have girls meetings activities, as the one of the speaker who have just spoken about the safe spaces in the community. We do have some meetings for girls only and boys. Here we do talk much about health and plus games, whereby within those games we do use the blending in of healthy information, health lessons, health sessions, and also to make ourselves to help each other, also to be aware what can you do and what could you do if at all you face such a challenge of health as an adolescent girl.
Okay.
Yes.
So how easy is it for you to enroll a girl for Tiko program?
To enroll a girl in Tiko program, it is easy for us as a mobilizer. We do have two ways we use. Basically, we do have phones. If I met an adolescent girl who has a phone, it's easy for me to enroll that girl, because we do have an app which we use to enroll that girl. And also, if I have not used the phone to enroll a girl, I can use a Tiko card.
Okay.
Yes.
All right. So on average, on a day, how many girls can you enroll?
Okay, a day, the average can be 3 to 5 girls, whereby if at all I move around beyond the community where I stay.
Okay.
Yes.
All right.
Okay, the beneficiary from this platform can also come in and talk about how she has benefited.
Hello, good afternoon. I'm Naga Madrid. I'm a beneficiary of Tiko program. Now, the way how I benefited and how I came in within this program of Tiko, I was at home and one of my friends called me to tell me about this program. And then after telling me about that, she told me she has a mobilizer who has to enroll me to join this program. If I'm not enrolled, I can't be among the program. But she told me to be enrolled, they start from 15 to 19 years. Then I was among in between those years, then I was enrolled into that program. Before enrolling me, she first told me about the advantages which I will gain from the program after enrolling me. She first told me about how I can help myself not to produce many children, and how I can help myself to move out of some problems and to move out of stress sometimes. Because she told me we can have some meetings to attend some lessons to teach us more about Tiko program and SRH services. Then after that, after telling us they got a day in a week. After getting a day, we used to get meetings and to take us to the SRH where we can get services from. After going there, they get our phones and enroll us into that program. We go to the SHR services, then we go to the nearest hospitals which can contact to the Tiko members. Then after getting through the hospitals, we talk to the nurses or doctor whom you're finding inside. You talk to her, email her that you are a Tiko member. After telling him you are a Tiko member, they have the numbers. They put in your number since you are already been enrolled into that services. After being enrolled, they ask you some questions. What do you prefer to use? they make us to learn about something, how to help us not to have many children who are not planned for. Then after that, after putting the message, after accepting, when you put yes, you get Tiko miles. After getting Tiko miles, they say you wait a little bit outside for 20 minutes. You are going to get another message to confirm whether you have received the services. After waiting for those minutes, you can receive the message. If you receive it, you reply the answer. After rating to receive, you have given the answer, you get other Tiko miles. Then if you get those Tiko miles, you go to the nearby shop which can contact with the Tiko members, because you can't go to the shop when it's not contacted to the Tiko members. If you go to that shop, you can talk to the owner of the shop that you are a Tiko member, so you have Tiko miles on your phone. After telling the owner of the shop, you give him or her your phone to check the Tiko miles. After checking them, you request for anything you want. But in most cases, since we go monthly to receive those services, most cases we request for our ORAs, which we call sanitary pads, because most cases we can be in our periods, since we are estimating to go to the goal of not having many children. Then that's how our Tiko miles help us. And next thing, we have enjoyed a lot of this program, so we can request this program may go on, like since they want 15 like to 19. Now some of the children, some of the adolescent girls have been gaining, but they are 19, and some of them have children. They don't have money to care of the children, they don't have money to buy or pads, but in those cases, those Tiko miles have been helping some adolescent girls to buy pads. Now, in case now someone has went to 2 to 20 to 25 years, they also need some attendance to attend those programs, because some of them also need to buy oranges for their monthly periods. Then if that's so, I can request whereby they can add like more years, like from 15 like to 25, because there are some other girls who face problems and they also need some help when they're like 25, 26 there.
Okay, thanks so much for that wealth of experience. Into the community where you come from, how easy is it for you to talk about services being offered under Tiko program?
It's easy for me because now I never had an esteem of talking to my fellow girls, but joining that program, I got the esteem to talk to my fellow girls and teach them all about the Tiko program and bring them to my fellow girls to teach them, and also to enroll them to help them not to have many children.
Okay, thanks so much for that. And then while at the retailer, and you said you used a phone for enrollment, right? What are some of the benefits of using a phone for enrollment?
Some benefits of using a phone for enrollment. In most cases, you can be having a phone and the phone can't get lost. Each and every time you can be moving with it, since it's a mobile phone. But there is this idea of giving girls cards. Some girls, you can come, you have a phone, yet she got a card. Sometimes she can go back annoyed since she has a card whereby she has lost the card, the numbers network is slow. But when you have a phone, you can come back next time. But if someone has got a card, she can leave it at home and she's not able to get the services. So phones are better because each and every time you can be moving your phones within your handbag, all in your hand.
Okay, fine. There is, thank you so much. We are getting a question that is coming in from one of our participants, and the question is, how do you connect to the girls?
Oh, I connect to the girls by reaching out them to the community. We do outreach. That's how I connect to them.
Okay.
Yes.
So when you say you do outreach, what does it mean?
Outreach, it's like you go to the community, you introduce yourself to them and the purpose as to why you're there and what you do.
Okay.
Yes.
Okay, so we have another question here. How do you support your clients or your rafikis?
I support them through giving out the information, do the follow-ups, encouraging them to go and they access the services, and we do different things in supporting, like we share information.
Okay.
Yes.
And then one very last question to you is how do you ensure that your clients from the community trust you?
We are friends because by the time I introduce myself to you and what I do and the program I'm on, yes, we do the friendship building. You become my friend, and when you're with a friend, there is a bond of trust. Yes.
Okay. So as a mobilizer, I can see you are very happy and you have a very smiley face. Is this a program that you think, in your opinion, is creating positive impact to the community?
Yes, as a mobilizer, I'm seeing there is a big positive impact because I'm seeing a change. By the time I started to be a mobilizer, encouraging my fellow girls to be on this program to access the service, there is really a big change in a behavior and a health-wise. There is really a big change because girls have been empowering their fellow girls. You know, you may be there and someone calls you that, you know what, there is also another girl who wants to access the service. There is also another girl who wants the information about the program. So there is a big a positive impact.
Okay, thank you so much. Thank you so much. Okay.
Yeah, so thank you so much, viewers, for staying tuned in and listening in. And we want to encourage you to send through those questions and comments about the program and what your thoughts are, and if you would like to know more about how the mobilizers are doing their work. But in quick summary, that is what we do in the community. So we work with mobilizers that are community-based. They're from this community. The people in this community know them and highly respect them. And they're of the same age. They are connecting us to their peers who really need the service. For those of you who don't know about this community called Bwaise, it's one of the highly populated slums that we have in Kampala. Just to my left, we have a very huge sex work business that happens in one of the biggest brothels that we have around Kampala. And you could see that the people within this community are not only affected by poverty, so unable to have the ability to actually access services, but the girls themselves are also vulnerable. They are not that empowered to be able to, to walk to a clinic and demand for a service. So the work that we do here is very important, and as you've heard, that these services of such a program is well needed and needs to be able to continue. So in such a community, that's how we are able to connect to the girls that need our service and link them to care. And for the next part of this Twitch event, we want to transition and walk with you to our clinic and just show you the journey. So the girl has been met in the community, she has been told about our program, the mobilizers successfully enrolled them into our program, and they need a service. So we want to take you to a clinic, which is community-based, right next to the activities we've been doing to this community. So a girl doesn't have to walk a long distance. We chose these smaller private clinics because they are deeply rooted within the community. They are next to the girl, so she doesn't really have to walk a long distance to be able to access the service. So again, keeping those questions coming, and you're going to walk with me straight to the clinic, and you have an opportunity to interact with the service providers and the other people.
Right. So we begin our journey to the facility. That is our community clinic, which is not very far from here, because our clients, we ensure that our clients do not walk far in terms of accessing the services. And as you can see, this is the community that we serve, and yes, it is very active community at this particular time. So right away from the community. We are headed to the clinic, and the clinic is very close, just to ensure that accessibility is not a challenge to our clients. And this is the entry of the clinic, and as you can see, there is a billboard up there having information about the clinic and yes, the kind of services that are being offered in this particular clinic. They are up there. And yeah, this is the reception, and you can see, yes. All right, so this is the clinic, and the service provider is right here. This is his office. Daktari, how are you today?
I'm good, how are you?
Fine, thank you.
You are welcome
Thanks so much.
to Reproductive Health Uganda.
Okay, thanks so much.
Yes.
So we are live, as we've told you, and we are having our colleagues and other partners who are also just following through to see our user journey right away from the community to the clinic, and see the kind of interactions that happen and the processes that you follow in terms of Tiko program. Maybe your name?
My name I'm called Peter Gali. I work for Reproductive Health Uganda, and I'm here today. Actually, I'm very happy to meet you, and I welcome everybody who's live and watching us. This is Reproductive Health Uganda Bwaise branch here that have been part and parcel of carrying out to Tiko activities and raising health services to marginalized communities, more so young girls here. Reproductive Health Uganda provides a comprehensive sexual and reproductive health services, where everybody is most welcome to come and access any service of her choice or his choice. Okay. And when we are here, we provide integrated sexual and reproductive health services. We have a variety of service package that we provide to young people, and when young people always comes here, they have a choice of their own and they interact with us. We are very free and friendly to them the way we handle young people. Basically, in terms of service provision, we have a free service delivery model where we always interact with different patients in different age groups in different areas. One of the service delivery model, it is the static clinic where you have found me, where clients have a right and they are free to come and access services at any time. Then the second one, it is the outreach model, where the health team moves out to the community and provides services when community mobilizers have tried to mobilize and gather communities. The third one, it is by the use of focal persons, peer educators and VHTs who refer people in need. So basically, when we are here as a service provision team, we do not discriminate any kind of person. From the marginalized, the key population, and when I talk about the key population, somebody may ask me, who are the key population group? These are the people who other people take them to be not normal in the way they do things, but for us, we categorize them. It is where you'll find the sex workers, you'll find the LGBT community, you'll find the drug addict, and other kind of people. Those are the key populations that we try to serve here. Then when we talk about the service packages, here we provide comprehensive abortion care, that is PAC. We provide family planning services as our core value. We provide antenatal care. We do provide gynecological services, HIV services, and many others, because it is an open space and we provide a variety of services depending on the need of the service provider. So basically, those are kind of things that we do. But as we operate, we do not operate in a vacuum. We have guiding principles that guides us to conduct some of these health services that we provide. I've been receiving a lot of questions. You talk about park, you talk about abortion. How do you handle this? This is something that Uganda has not legalized, but the need is always there. And when a client comes in such kind of intervention and he needs an intervention of a health worker, we have some protocols and guidelines that helps us to see how basically we can handle such a client through taking this client in a comprehensive counseling, and our interest in the counseling to make sure that we do VCAT or value clarification attitude change of this client before we come to a conclusion. But as also you know, when a client comes with a service and he needs that service, if you don't provide, he will seek that service in any way this client wants. So we always take our time to talk to these clients, and that is why this facility has managed to raise a number of young people coming to access sexual and reproductive health services. Basically, that is the little I can say, but we have a lot. And when we come in terms of the statistics, daily we always receive young people are not less than 20 who access services, basically family planning services, and more so Tiko project. When it came to Bwaise, it has tried to create demand, and actually right now we are trying to figure out how best can we manage the demand that the Tiko project has tried to create, because now young people are free to come and access services at any time that they want. Two, they have a choice of services that they want. HIV services are available for young people, and now they have managed to understand and to get to know their status at all times. We have tried to combat the teenage pregnancy that have been rising because young people are not aware about their sexual health. But right now, at least due to the interventions, community dialogues, community outreaches, the peer educators who always refer these clients, they're in position to come and have free consultation services for young people. We can always provide all necessary support, and also we are working with partners. As you know that the RHU, its strength is working with different partners, such that when partners come, the way Tiko came, it is helps us to have a holistic approach in terms of service delivery. What we cannot manage, a partner can come in and really support us. That is why we have managed to move along with the Tiko program from the start up to now, where Tiko created demand, and now for us, we provided the services to young people, and we are still continuing providing services to these young people whenever need comes.
Okay, thanks so much, Doc. We are having a question from one of our viewers, and the question is, how have you seen change in behaviors among the young girls that you serve?
Actually, when you recall my discussion that creating demand and attitude change, it has been really created, where initially young people used not to come to access these health services, thinking that it is only for elders to come and access services. But now young people, they are free to come and access services here. They are free to come and consult, since our consultation is free of charge and we don't charge. So they have understood their health behavior, their health life, how they can protect themselves, self-defense in terms of any kind of health abuse. GBV cases, we have realized that among young children it has reduced because they know how now to work closer with their parents. Parental guidance, we have also been in close working with young people. It pulls us to go further, also to understand their social lives and how they live.
Okay, thanks so much. Now, looking before Tiko program and now, when you are on this particular program, in terms of demand generation, Would you speak to it and tell us if there is an increase in terms of demand or things have remained the same?
Indeed, as Stella said earlier, that the coming of the Tiko program, it has created demand. Actually, it created access to services. And now creating this access to services, young people now they have managed to know that where to get these kind of services. Now the demand has increased. Before, young people between age of 13 to 15, 16, they used not to access or to come to the facility. But currently, we see young people now, without even parents, they're in position to come and at least consult whenever they have problems. So this has created more demand. And also we have realized in terms of family planning services, young people used not to know about these kind of services. That is why they have been having this kind of sexual intercourse and pregnancy. And we have seen young mothers now coming up. But at least due to this intervention, we have seen low young mothers. At least we have different kind of engagement with them.
Sure, thanks so much. Talking about enrollment, maybe being my very last question on this. On average, how many clients are you able to see on a day?
On a day?
Yes.
Actually, our average here, it is between 20 to 25 to 30 clients. But among those 20 to 35, you will find that young people are contributing almost 70% in access to this facility. But before, we used only to have mature people who used to know that this is reproductive health, so we are handling with reproductive system only, not knowing that also their problems can be really managed here. But at least now you will find that out of the 25, you will see that 14 or 15 people to 16 young people between the age of actually I will say 14 or 13 to the age of 20, roughly there.
Okay, thanks so much. We know you are busy and you still having
in fact some clients are there waiting for me, but I wanted just to give you this some time.
Yes, thanks so much. We really appreciate for the time that you've given us. So thanks. We want to let you continue with your work, seeing other clients as we proceed to the retailer, and we'll keep in touch. We'll continue with this partnership. Thanks so much. So this is the time we are exiting the clinic, and as our user journey is designed, right away we are getting headed to the retailer where a client does redemption of the Tiko miles after getting services. As you can see, this is a very youth-friendly clinic, and we have also branded the clinic just to ensure that our clients are sure that they are at the right place to access their services. So at this particular time, we are going to exit the clinic and get headed to the Tiko retailer, get to hear from him and see how his interaction goes with the clients from Tiko program. So with us, please follow through. Let's get headed to the Tiko retailer, which is not that far from here. So we are just going to cross the road, and then there will be at the retailer. Remember, one of the things that we really try to address is to ensure that all our clients do not walk far away looking for the services that we offer. As you saw from the community to the clinic, it was very close. Then again, from the clinic to our Tiko retailer, it's just right across the road. And here, if you can see, here is the shop, and it is well branded just to help our clients get to identify it without any problems. So this is the Tiko retailer, and here is the owner of the shop. How are you, sir?
I'm fine, sir. How are you?
I'm good.
I'm glad to see you.
Yes, please.
You're most welcome.
Yeah, we are also very happy, and today we are here just to check with you and see how are things in terms of Tiko program, and maybe you explain to us the kind of processes you undertake when you receive a client from Tiko.
I'm Abena Mark here in Bwaise, Road. I work as a retail in the Tiko platform. I receive girls aged 15 and 19, recent girls.
Yes.
So they come with their Tiko cards. Their Tiko cards when they come from the clinic. Sometimes they come with the Tiko cards and they come with the phone. So when they bring the card, I get the card and I do card pay. I put member ID. I put the amount of money they have before. Then first of all, I first check the balance. When sometimes they have 2,000.
Yes.
Then after checking the balance, I do card pay. I put member ID. I put the amount of money they have on that card. Then they ask me the PIN. Then afterwards, when everything is done, I give them the things that come from their amount.
Okay.
Yes.
Okay, thanks so much for explaining. How easy is it for you to operate the Tiko platform when you are serving your customers?
Come again?
How easy is it for you to operate the Tiko platform, sending the SMS from your phone?
It is not bad. It is easy. Yeah. Because the network, when I'm operating, when I am doing, they are not hard.
Okay.
Yeah.
So
it is simple.
Okay.
Yes.
Okay. So how has this program benefited you as a retailer?
It has benefited me a lot.
Yes.
Since I joined this platform, there is an increase in sales.
Voice.
Okay. There was an increase in sales.
Yes.
Yeah. Sales has increased when I'm buying and purchasing. So my business has expanded. It is not like the other time, sometimes back.
Okay.
It was small.
It was small. Okay.
For sure. When I joined that platform,
yes,
everything changed.
Okay.
And I love that, and I appreciate that. I appreciate everything I got in this platform.
So, from your experience, what are some of the frequently purchased goods or products for the girls?
For those girls,
yes.
For them, they used to take pads, sanitary pads.
Okay.
That is the best they need.
Okay.
They used to take soap, pens when they are schooling, pen, books, and some others like sugar.
Okay.
Yes.
Okay, that's nice. So you coming from this community and you are a member of this community, do you think this project is benefiting the community?
The community is benefiting a lot. In terms of money. Like
yes.
When the girls are getting these pads,
yes,
instead of buying them,
yes,
the parents are no longer buying pads.
Okay.
They are saving those money that they would have used to buy pads. So the community is appreciating the service. Even in the community, there is education. They have educated. Their girls have educated a lot in this program, Tiko program. They have good health education. They are no longer getting pregnancies. They are they don't want. And so in that regard, parents appreciate that one. Their girls are no longer dropping out of schools. Their girls are no longer getting pregnancies. So when their girls are happy, even the parents are very happy.
Okay.
Also.
Okay. So this is a program that you would like to continue?
Yes. We would like to continue now and onwards.
And onwards.
Without stopping.
Without stopping. Okay.
Yes, yes.
Okay, that's nice to hear from you. I think as you've heard from the retailer, from his side of story and experience, he is also attesting to it that this is a project that is impacting to the community. Right away from the client to the mobilizer, to the clinic, to the retailer. Each and every person is talking about the benefit that the program is having, not just to them but to the large community. So at this particular point, this is where we end our journey. The journey begins into the community, to the clinic, and all the way to this particular place. So up to this point, we come to the end of this visit, and thank you very much for each and every person who took part to this. You took your time to join to this, and thanks so much for your questions. We seek to end our field visit today. So as we close, we will still definitely go back to the person who started this visit, and he is the program lead. So he is going to close the program for us.
Yeah, so thank you so much for walking this journey with us. It's been an exciting experience to take you around our community, for you to be able to see how we identify the girls in our community, for you to see how we link them into the services, but also most importantly, as we've heard from the retailer, we are not only delivering health impact, but we are also giving back to the community and developing and also making improving economies in the community as well. So through our funds and reimbursement, and as we've heard also from the service provider, all the services that are provided to these girls are free of charge. So Triggerize covers that cost barrier for the girls, and we pay for the services. So it's been an exceptional experience. We are very excited. Thank you for walking this journey with us through the entire journey, and we look forward to partnering with you to take this program to scale. And as we move to next year, we hope that you will be with us, and we look forward to taking you more around other economies. We implement in Arua as well, and all our programs, we've tested them both in rural settings, very urban, that is Arua, in a rural community like this. We've tested it in urban centers, and it seems to be working very well. And so we hope that we're able to take this impact to change more lives of very many adults and girls and boys within the community, and continuing to serve those that are underserved through our Tiko platform. So thank you so much, and we hope that you can enjoy the rest of the morning, the afternoon, and the evening in your day. Thank you. Bye-bye.